guest of honor, the Right Honorable Prime Minister, to address us and officially open our conference. Thank you very much.
Professor Bazeyo, deans, dignitaries, ladies and gentlemen, I'm glad to join you in this important discussion on advancing health care for our people. I must, at the outset, salute the United States government, officials, and the people, taxpayer, because they have been reliable partners of Uganda and Africa in the struggle for better health for all. They have headed a program of global health security with amazing success. And it's true, it's now good to know that to diagnose Ebola, you don't have to send the samples to Atlanta and wait for some time. That these issues are now easily done and done around, and thanks to the capacity building and support that Uganda has received from the government and people of the United States. And some of the officials who have been catalyzing that process are not far from here. Nevertheless, keep it up. I would also like to take this opportunity to thank the US government through USAID for the continued support to advancing One Health agenda in different parts of the world, especially in our two continents of Africa and Asia, and I'm very happy that Asia is well represented here. With this support, technical and financial, a lot has been accomplished in building One Health capacity and making significant gains in ensuring global health security. We have no doubt that if implemented well, One Health offers us the opportunity to set common goals, create synergies, strengthen communication, and share resources. And it's good to see Professor Kabasa, Professor Bazeyo, and others interacting easily as if they were in the routine management of a common discipline. So One Health is already producing very good results, I must say. And we hope that even outside this conference, in day-to-day practice, that will be the routine. The recent experience with Ebola outbreak in neighboring DRC, crossing over to Uganda, and how it was and is being managed by the two countries working with partners is a very good example of how One Health approach can be effective in protecting global health security. Evidence has demonstrated that traditional skill sets and approaches can no longer be adequately used to manage the health challenges that come with complex interface of animals, humans, and the environment. This therefore requires a new approach to training and building of a workforce that is ready to work across disciplines and also across sector lines. Efforts like those implemented under the USAID supported One Health Workforce Project and other projects in different parts of the world have the potential to change the way we approach training of a One Health workforce. A key objective of this project is supporting One Health university networks in Africa and Asia to work with governments and other partners in defining One Health workforce needs. This ensures that we design evidence-based capacity development strategies and programs and can therefore be able to to deliver on our global health security action packages. There is a challenge, however, of being predominantly donor-supported. National governments have to be engaged with evidence of what works in order to mobilize local funding to ensure sustainability and institutionalization of these initiatives. As government, we are resolved to drive our national One Health agenda and plans. We are committed to mobilize resources locally, financial and otherwise, to ensure sustainability of programs. The Minister of Health is our lead commander in this sector. This is a serious point. Many of our countries in Africa quite often have received and act on good programs supported by the donors or development partners. The program starts, it works, and when the 5-year term, which was the originally planned for that program, ends, the good program also ends. The beneficiaries stop benefiting, and the program has no sustainable impact in delivery of services. Therefore, sustainability must be the cry word for all of us, especially when we are thinking, planning, and engaging in good programs which are supported by our development partners. And the mechanism of winning from the donor support to country support must be clear, or else the program should not start, because it will be giving false hopes to the population. Let me conclude by once again appreciating this initiative and assuring you of government determination to building One Health capacity. The country launched the National One Health Strategic Plan 2018-2022 in February last year, in which we agreed to adopt the One Health approach to address 3 priority areas: zoonotic diseases, antimicrobial resistance, and also biosecurity. Let me also thank the team that has worked hard to ensure that this conference takes place. I have in mind many of you. Our key person, Professor Bazeo, who has been doing a lot of work and heading the whole project in our environment and in our region. David Kabasa, Professor Wambula from Tanzania. Actually, this is a multinational conference, and multinational and multi-continental, which is really a very good thing. It seems this has been a gathering of humanity, and I commend the project for achieving this. Also, the universities of Minnesota and Tufts University, and it is therefore now my great pleasure to declare the 3rd International One Health Conference officially open. I thank you.
Thank you, Right Honorable Prime Minister. We are going to have the anthem shortly, but As we do that, we are also taking a group photo.
Great, great and mighty, the walls surround thee. Great, great and mighty, the gates beside thee. From east and west, from north and south, all voices singing, arise, Makerere, rise up and rise, high up and high. All voices singing, arise, Makerere, 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 the great Makerere, great, great and mighty, the walls surround thee. Great, great and mighty, the gates beside thee. Great, great and mighty, the walls surround thee. Great, great and mighty, the gates beside thee.